Good evening, viewers. It's episode 31 of COVIDCastJA. We are delighted to have you here with us for another broadcast. This week, a particularly special broadcast because we're technically going back to our roots because we are talking about COVID itself. So today we're talking about living with and understanding COVID-19, and it is COVID-19. You know, many of us have all manner of myths that we've created. Some of us have created our own concoctions. Many of us don't understand the various testing terms and just generally the terms that are being used. And you know, sometimes we don't understand, but we never ask no question. We just go along with the flow. So today we're setting a baseline understanding so we all get a full, just almost the A to Z of COVID. That's what's going to happen tonight. We are going to be joined by two very special guests, Dr. Bowen, as well as Dr. Karen Webster-Kerr from the ministry. So we really will get the full gamut of education tonight. I'm seeing Jennifer Brooks, seeing you. Hello. Hi, Romeo Stewart. Good evening. We're all excited to be here. So we're also, Nevada, it's long time I don't see you though.
Yes, come back for this one. No, Rachel, this is an important show because I find that even for me, it's all the information in different places. It gets confusing. What am I supposed to do? How can I stay safe on the bus? When I go into work, what am I supposed to be looking for? All of that stuff. And it's a lot to take in. So when you said that, you know, we should do this program and start again from base level, make sure everybody is kind of up to speed on how we're going to live with this thing, because it's not going anywhere anytime soon. So for me, this program is critical.
And you know, it's so funny. In March of this year, when COVID, as I'm saying, when COVID kicked up on way, we thought somehow it would be all over. But no, you carrying your mask, wearing your mask is just a natural thing. Even when we used to see people in a mask first, we say, "Oh, look, and then enough me." No, today we really get an understanding of what this is all about. And you know what happens to us, and this show is all about breaking things down. So we do have an understanding. We recognize that everybody learns differently. And every week for COVIDcast, there is a written memo that is prepared and circulated. And you may be saying to yourself, circulated to who? How come I don't get it? If you haven't gotten it, please email us at sme@psoj.org. But very importantly, all of these COVIDcast shows, and we're at episode 31, which means you have missed 30 episodes. All our episodes are available right here on the Facebook page, right here on YouTube, because you know we can be in several places at once. But also, please visit smallbusinessportal.com. You'll have access to all the memos, and the memos are detailed. They give you a nice breakdown where you can sit down, because you know some of us need like a paper and we sit down and we read, and then you can match it back with the episode, because when we come online, we're actually now having the conversations with the experts, and it's conversations that are done in a way for you to understand. So Nevada, our first guest today is Dr. Bowen, who is founder and CEO of MD Link. Now, Dr. Bowen is a Trinidadian-born event manager and medical doctor who graduated from the University of the West Indies, Mona, in 2010. He was inspired to effect change in the Caribbean after working in both the public and private healthcare systems in Jamaica. He embarked on a mission and began his research into the remote provision of healthcare services enabled by technology as a solution to lessen the strain on resources in the accident and emergency departments of public hospitals caused by overcrowding. Finally, he founded MD Link Telehealth Services, which is the first of its kind in Jamaica and the whole region, this whole Caribbean region. And isn't that fantastic?
Fantastic. That's how we like to roll.
It was launched in the summer of 2008. MD Link has consistently provided instant access to affordable quality healthcare anywhere in the Caribbean at any given time over its secure platform via text, audio, and video. It provides a wide range of medical services for common, low-risk conditions, including providing prescriptions directly to pharmacies, diagnosis, and scheduling further tests. This is telemedicine at work, what we used to talk about long time. This is telemedicine, live and direct. There has been a major increase, of course, in the number of patients and doctors registered to utilize the platform since COVID-19. So it was launched just in time. More than 100,000 patients and 150 doctors providing much needed medical advice across Jamaica, Barbados, Trinidad and Tobago, and the Cayman Islands, among other islands. So,
Dr. Che, big up yourself. Big up yourself. Dr. Che, whoa, proud of you.
Hi guys, how's everyone?
We are so pleased to have you tonight, and we really are looking forward to this conversation. Nevada, let me give you.
All right, to start out. All right, again, Dr. Che, the purpose of this program, right, is we went from the beginning to like have the simplest questions answered so that everybody in Jamaica get a good baseline. So we're going to start with 101. What is COVID-19 and how is it transmitted?
Sure. So COVID-19, everyone has been, being hit by this word COVID-19, COVID-19. What is COVID-19? It actually stands for coronavirus disease. That's COVID, coronavirus disease, and the 19 is 2019. And to explain in simple words, straightforward, it's a highly contagious infectious disease. It affects the respiratory system, the vascular system, and it's spread by the coronavirus. It's caused by the coronavirus. That's the SARS coronavirus. How is it spread? Simply by airdrops, by particles, by speaking, water particles coming out of your mouth, by coughing, by sneezing, even the fluid in your eyes, they can help to spread the virus.
So, Dr. Che, one of the things that we're hearing, and I don't know if anything goes so people have said things like we have 4 strains of it in Jamaica. Are there different strains that do different things, or is it really only basically one strain?
Right, that's an excellent question. Actually, as far as the data shows, it's still only one strain.
Okay.
However, what's interesting is that the coronavirus seems to be affecting us not as severe or not as intense as other places, other locations, especially America, Italy, those locations, China.
Right. Understood. Well, what's not clear is whether it's us who have some tough constitution, or if it's a strain that's here. Understood.
Or the environment, even the sunlight.
Okay. Yes. And we're more outdoors and we'd have our winter and stuff. Excellent. So that's clear. Talk to us now about a little bit about the masks. And we know we all have to wear masks and stuff, but what are the best types of masks?
Right. So there are a lot of masks out there on the market right now. There's the N95. The 95 actually stands for 95% protection.
Yes.
There's the KN95, which is a step down from the N95, but the N95 is the go-to, the #1 mask in production out there for healthcare professionals. There's the cotton mask. There are all sorts of different masks. Everyone is coming up with a new mask every day. But the most important point comes down to, forming that seal around your mouth, securing that seal, and also allowing you to breathe. So the mask has to be made of cotton so that you can breathe. In fact, a few of my patients, the asthmatics, they're having trouble breathing. You tell them put on the mask and they can't breathe, with the mask on. So it's interesting to know that there are persons out there that are being forced to wear masks, but they can't breathe. They need special masks.
Understood. But just to be clear, because we see a lot of this too, if I'm wearing a mask like this, that don't work.
No, if the mask is below your nose, you're still inhaling and exhaling through your nose. The water particles are still moving through your nose, and it's not as useful at all. It's probably 50%.
So you have to cover the entire area.
Correct.
Okay. We've heard a lot about the thing with sometimes masks with charcoal or salt. Is that useful? Is that anything there? Is that a myth? What's the story with the charcoal and the salt?
The charcoal, activated charcoal or activated carbon, they're they're basically making an insert. So you can insert this into your mask and you have what is called an activated carbon mask. And what it's meant to do is attract the particles and form a stronger filtration than just the cotton. And it does in fact filter better.
Okay.
The only problem is that you're also at risk of inhaling activated carbon particles. It's not necessarily the best thing. So it's a good and a bad. The advice is to stick with the cotton mask.
Just stick with the cotton mask. Now, tell me about the face shield, which we also see, and that in conjunction with the mask. Can you do the face shield instead of the mask? Tell me about how face shields work in this whole environment now.
Right. So face shields, no, they definitely have to be used in conjunction along with the mask. Otherwise, you're defeating the entire purpose. What the face shield does is exactly what it says. It shields your face from particles. So all the particles from breathing, from talking, from sneezing, from coughing, it shields it. But the particles, they'll hit the face mask, they'll stop there. Some might go around the face mask. A percentage might go around the face shield, sorry.
Yeah.
If you don't have on that extra protective layer, that extra face mask, then you're still at risk.
Okay.
In those particles and getting infected.
Another question that has come up with some of our viewers: the whole idea of wearing two masks, especially if you have to go on a public transportation, does that help, or that does? Because what I've heard is, if you wear two masks on public transportation, where it's hard to do the social distancing.
Yeah. Or on a flight.
Yes, on a flight, you are better off. Anything go so?
Wearing two masks, again, interesting question, because yes, you have double filtration, double protection if you wear two masks. But the most important thing is the seal that you have around your face, and the N95. Again, a cotton mask, the N95, it provides that seal, that extra protection. So yes, I would say as long as you can breathe properly, go ahead and wear two masks.
Okay, so for those of us who taking public transportation or getting on a flight and stuff, wearing two masks could provide like extra protection for us.
Extra protection,
fantastic. Thank you, Dr. Che. Question now, we hear a lot about this whole notion of flattening the curve. And how is that connected to our healthcare delivery facilities? What do you mean to flatten the curve? And why is that relevant to us and the healthcare facilities?
Right. So with coronavirus, there are indeed a lot of different curves, but the main curve they're talking about is the spread of the curve. And it's a graph. And when you speak about flattening the curve, you're speaking about controlling the rate of the spread, controlling how many people are getting the virus per day. And by controlling that rate of spread, you allow especially the Caribbean, being that we don't have as much infrastructure as first world in health infrastructure, it allows us to slowly but surely manage the new cases as they come on. Whereas if we're not flattening the curve, and to flatten the curve, you have to obey the protocols, the COVID rules, your social distance, you wear your mask, you keep your hands clean, you sanitize, and that is what in fact leads to flattening the curve and decreasing the spread of the virus and helping us in entirety to more or less control the virus stronger, more efficient.
So is it because we lack? So we also hear this discussion about herd immunity. Joe, make everybody get it. Is it because the facilities that we have cannot manage a lot of sick people that we cannot move towards a situation of herd immunity because we're going to overwhelm the healthcare system, and therefore better for us to try and protect ourselves?
Right. Herd immunity is interesting. And you have two types of herd immunity. You have vaccination. Of course, we have no vaccine for the coronavirus. And then you have, I like to call it natural selection or exposure to the virus. And what it does is you get the virus and you develop a defense to that virus. You survive and you're able to fight off that virus the next time it comes because your body knows what it looks like and quickly identify it and fight it off. So I would actually go as far as to say that herd immunity has already started happening in Jamaica.
Yes.
Okay.
It's somewhat inevitable.
So, Dr. Bowen, and for our guests who are just joining us, and we're seeing lots of you logging on now, we are joined by Dr. Che Bowen, who is CEO of MD Link, and we are talking today about living with and understanding COVID-19. Now, Nevada just mentioned going to the hospital, and one of the things too that you talked about is with telemedicine, with using MD Link services, people are able to stay in their homes, they're able to FaceTime, text, use audio, etc., to reach doctors. How
Right.
does your telemedicine type of service help to facilitate this flattening of the curve?
Okay, great. It's good to know that when coronavirus hit in earlier this year, you know, around February, March, the CDC quickly acknowledged the situation and said they put forward the guideline that stated that, you know, we should move towards telemedicine. It will help us social distance. It will help us flatten the curve. It will allow us to still move forward with healthcare during the pandemic. So they advise all of America to move towards telemedicine. Luckily with MD Link, I had created the platform 2 years ago, and it was going slowly, getting some traction, you know, daily usage from patients. And then when coronavirus came, it moved from more of a convenience to necessity. We saw everyone coming on board. And again, what it does is it helps to flatten the curve directly by encouraging social distancing,
Yes.
providing instant access to healthcare, and decreasing the spread, flattening the curve.
Yeah, because what it does is that it now creates less movement outside of for us gathering together. So when you have some symptoms and stuff, it's better you go on MD Link to find out than you jump in a taxi.
Correct. And there are even more advantages or benefits from the whole telemedicine situation, in that us seeing the minor cases, us advising people where to go, that takes a lot of pressure off of the hospitals, and they can go forward and focus on saving the lives that they need to save.
Okay, thank you so much. Now, since in a few years I too will be an elderly person, for our viewers who are say over 65, should they be behaving differently? So we see different rules. I think our age here is we recommend that persons over 75 stay in and work from home. Should you really be behaving differently as an elderly person? What are the risks to elderly people? Is it real?
It's very real. In fact, I would say coronavirus, it affects the elderly. You know, it is targeted at the elderly. The elderly is who we have to care about. You know, you hear people saying you don't need to wear a mask. I'm fine. If I get it, I'll be okay. Sure, you might be okay, but your grandmother might not, your grandfather might not, you know. And what the data is showing is that the elderly are the people that are dying everywhere. 80 years and up, that's the highest demographic of persons that are dying. So definitely you want to educate your elders, educate those persons 70 and above, even as far back as 65 and above.
Yeah.
They need to be very conscious, very educated, you know, social distancing, staying at home as much as possible until the situation is brought under control.
Yeah. And the flip side of that, Dr. Bowen, I heard a young person just recently speaking and saying that he was saying that he's 26 years old, him go at gym, him body fit, him eat good. So him know say corona have to bounce off of him muscles. Now, is there any such thing? I mean, is it that if you're a healthy young person that you're eating right and you go to the gym and your body stay good, that corona is going to avoid you? Or are you just as susceptible to catching corona?
It will definitely not avoid you. You are susceptible to catching the coronavirus. Everyone is susceptible. The good news is if you are in fact young and healthy, it's one, less likely to kill you, less likely to move to anything too severe, any sort of severe illness where you need to be hospitalized and such. However, on the flip side, I have had patients 100% healthy, strong, never sick before. They have never seen a doctor's office, and all of a sudden they can't breathe.
Wow.
Wow.
That can
breathe. Literally can't breathe. So coronavirus is still very real, and I need everyone to know that people are dying. I have friends that have lost relatives, so yeah.
You raise this issue, which I guess the segue now into what are the symptoms? What are the symptoms? What am I looking for now to say why I may have this thing, you know?
It's a fun question again, because dengue is around, the flu is still around. I would actually say flu levels have decreased throughout this year because everyone is washing their hands and social distancing, so that's good. But dengue is here, and all of their symptoms match. They all look the same. The key differences with the coronavirus, you're going to be coughing. You're going to have a fever.
What kind of cough? Soft cough or mucus cough? What kind of cough we're going to have?
A dry cough. A dry cough. So usually you're not bringing up cold, a lot of cold and stuff, but it's a dry cough. You're going to get that dry cough. You're going to get fever. The other distinctive feature of the coronavirus is the chest pain. Now, I used to think, how are you going to get chest pain with the flu? I had my patients coming in and they're grabbing their chest. They're fine. Everything else is fine, but they're just having this strong chest pain. So is
it kind of like a heart attack chest pain, or what?
Not really like a heart attack chest pain, but yeah, it's central and
tired.
Yes.
Tired. I get so tired. What about this thing about the taste?
Yes, I heard
taste and the smell. Eh?
What's that one? Sorry.
Go ahead, Rochelle.
No, I was saying with the chest pain, because a lot of people have, gotten a little bumming now, that we take on illness. So any little pain we feel in the chest area, we think is COVID. Have your patients actually described a distinct, is it a tightening? Is it a pressing? What is that, the chest pain? How have they described it?
More aching, actually, and a heart attack is more pressing, so it's more like a chest ache. That's how I would describe it. And you cough, it pains more when you cough, it pains more when you take a deep breath in and out. So those three symptoms, as well as loss of smell, those are significant symptoms.
And loss of taste, I've heard loss of taste as well. Are those common, loss of smell and loss of taste? Is that common or that's more rare?
It's more rare, which helps to make it, align it with diagnosing the coronavirus. Those symptoms. Of course, you have a lot of the other flu symptoms like your muscle pain, your aches, your fatigue. You're generally weak. You're tired. Yeah.
And how long typically? I mean, I know some people can go for a long time, but on average, somebody who has the symptoms and recognize that they do have it, how long does it typically last?
We're looking at 2 to 14 days.
Okay.
That's the period when you're highly infectious. You can spread that virus very quickly. Since we're on the topic of symptoms, it's very important to highlight the asymptomatic presentation of the coronavirus. So again, we do have a lot of persons in Jamaica with the virus that have no clue that they have the virus.
So how do those people find out that they do have it? How does that work?
Well, some they don't feel they feel fine, so they just go about their lives. They naturally recover. Their symptoms don't affect them. Good to go. Yeah.
Okay. Let me ask you about comorbidity. That whole what is comorbidity and how do I have to behave? Me have my diabetes. Relatives have high blood pressure. What's the implication of that in these times?
That's one of the criteria we look at when we admit patients to the hospital for the coronavirus for treatment. We look at the comorbidities, because what coronavirus does, it affects the elderly and it affects persons with comorbidities. And when we speak about comorbidities, we're talking about chronic illnesses, diabetes, asthma, COPD, hypertension, those sort of diseases, even cancer, immunocompromised states, HIV, cancer. Those are the comorbidities that really put you at risk. When you catch the coronavirus, it goes into all of your cells as quickly as possible, infects the entire body, and what it does, it causes your organs to fail. Right, and persons with comorbidities, they already have more or less damaged organs. So their organs are already weak. You know, you have diabetes, you have high blood pressure, and you get the coronavirus. It's going to attack that diabetes, attack that hypertension. All of a sudden you realize that, hey, you're taking your hypertensive medication and it's not
working.
Not
Wow.
working.
Okay.
Mm-hmm.
So there's the issue of the testing, Rochelle. Let's address that.
Actually, I just saw a comment here from Chris Record. He says, stress and anxiety has caused me to think that I have it at least 4 times already. In fact, Dr. Bowen, as you were speaking a while ago, my chest started hurt me immediately. I lost all smell. But so the thing about it too is that as we hear more about COVID-19, you know, sometimes we actually start thinking that we have some of these symptoms, and many of us who may be traveling and for some jobs do have to do testing. And I was recently on the Visit Jamaica website that spoke about, I think they require PCR antigen testing, and immediately I got confused. So we actually do want to talk about the various types of testing. So can we talk about what is PCR versus antigen versus antibody testing? What are all of these about? And I hear some of them are uncomfortable.
I would say all of them are uncomfortable because to diagnose the coronavirus, you need, at this point in time, you need a nasopharyngeal swab. There are some saliva tests out there, but when we talk about the tests that are approved by the FDA, it's just like you said, the antibody, the antigen, and the PCR. PCR is the gold standard. Some say it's too sensitive, but it's the gold standard of diagnosing. It's the most accurate. And what it stands for is polymerase chain reaction. So it's real-time reverse transcriptase polymerase chain reaction. Big fancy name, but it's the most accurate testing, and it is available in Jamaica.
Okay. How is that one administered? That's the big word that you use about nasal.
The big Q-tip. The thing that you like, the big Q-tip.
Correct. So yeah. 6-inch Q-tip that goes into your nose, and you go back until you hit.
And this test tells you whether or not you have it. Is that what this test tells you?
Correct. It tells you whether or not you have it.
Okay, so it comes back with either a positive or a negative, because we're going to talk about the other types of results.
Right. It comes back whether positive or negative. It's only performed by a lab, so you need a lab, a big machine to process these samples. Big expensive machine. You have to be an accredited lab to process polymerase chain reaction. So only a few labs are approved and such.
Okay.
And then the other drawback is that it is very expensive.
Okay.
And it takes up to 2 days to get back results, so it's slow.
Okay. Just to give us a sense of the cost, if you did it privately, what kind of money we're talking about?
You're looking at a range between $18 to $25 up to $40,000 for one test.
Okay. All right.
Okay. Correct. What about the antigen test?
Right. So the antigen test, again, that's a diagnostic test as well. It's faster, 15 minutes. It's on the spot. So you don't have to send it to the lab. You can do it in your doctor's office. And it's diagnostic. So it tells you whether or not that person has coronavirus.
Okay.
The catch to the antigen is it is not as sensitive as the polymerase chain reaction. Therefore, you have a smaller, or I should say a larger chance of getting a false negative or a false positive.
Okay, and tell us a little bit about the false negative and false positive.
Right, so what that does is it points to how sensitive, how accurate the test is. If you're getting false positives, it means that you tested, test said positive, positive for coronavirus, but that is false.
Okay. So what's the cost of the antigen test? How much that would set somebody back?
You're looking at around 8,000 to 10,000. So it's half the price, more than half the price of the PCR.
And how is that one administered?
Again, nasopharyngeal swab into your nose straight to the back.
Okay. So for the antigen test, say it comes back with how do you determine if you need to do the test again? I mean, it comes back positive. Do you say to yourself, I don't really feel like I have COVID, let me do it again? What makes you
you have to use the symptoms along with the antigen test.
Okay.
So if you're having symptoms and you do the antigen test, it's highly likely that that positive that the antigen showed is positive.
Correct. Okay.
Right. If you're having symptoms, coughing, fever, chest pain, and you do the test and it's negative, something must be wrong. So you should get a PCR test.
Yeah.
So
you upgrade. Okay.
Correct. Correct. But in the grand scheme of things, an antigen testing is being used widely in a lot of the first world nations. It still helps.
Yes.
Still helps, yeah. It still helps a lot.
And then there's the antibody now. What is that one?
The antibody was the fastest to be developed, and the first to get distributed and spread out. And what it does, it lets you know if the person ever had coronavirus in their life.
Oh, so you could either have it now or have had it, but finish with it, and it will tell you, yeah, yes, you did, or you okay.
Correct. So if you had it in March and you come to me and you want to travel and I test you today, it'll tell me you're positive, so you can't travel. So it's not accurate, it's not sensitive, it's not specific, so it's not very helpful, and that's why it hasn't gone mainstream at all. That's why Jamaica kept it out of here by every means possible.
Yes.
Because then you'd have people walking around thinking, hey, I'm negative, I'm good, but they're actually positive.
Actually positive. How is the antibody test administered?
The antibody tests, there are both types, nasopharyngeal swab and the blood.
And blood, okay, that's the one. Blood, okay. I see Richard Stewart saying very informative. Empowerment. Dr. Smith is grateful for the episode. We're very grateful too, because when I start using these terms, I hear that thing say I could open up MD Link myself. So Dr. Bowen, in terms of when you should get tested, so we know that you need to get tested when you're traveling.
Right.
Under what other circumstances? You say you have some symptoms, should you just stay home, lock down for the 14 days? Or is it that you have symptoms, you really should go and get tested, or you've been exposed, you should go and get tested? When should you decide to go and get tested?
In the ideal world, every single Jamaican should wake up and get tested every single day.
One again.
Every human being in Jamaica every day. We don't have to worry about anything. That would be an ideal case. But we can't do that. It's expensive.
Right.
It's expensive for everyone. On top of that, not everyone wants to get a swab in their nose every day. So so in an ideal world, you want to get tested every day, but right now, how we look at it is we look for the risk factors. If you're elderly and you're having symptoms, yes, definitely get tested. If you have comorbidities and symptoms, definitely get tested. If you don't have comorbidities, you feel fine, you can go and you can check your vitals with a doctor, and they might just tell you, stay home, stay safe, quarantine, you can recover on your own. Nothing is going to go in the wrong direction.
Okay.
So testing we try to reserve or use again for high-risk patients, because they are the ones that are risk of the situation going bad, whereas everyone else can get the virus like the flu, survive.
Let me ask you something. If I don't have symptoms, but I've been exposed, somebody in my house or somebody at work, I found out that they're positive. Should I get tested? Even if I was wearing a mask and being distant, should I get tested?
You should. Indeed. If you're exposed and you're going to be out there, get tested so you can know that you should stay home or not. You can know that you should be avoiding persons. You should definitely be wearing your mask 24/7. It's good to know in that case. Another reason to get tested is if it's really affecting you mentally. Like, just like Rochelle said, a lot of persons are out there thinking, hey, this might be a chest pain or coronavirus.
Yes.
They sneeze once and they're scared. So you can log on to MD Link. You can speak with a doctor right there from the comfort of your home. We can assess you via the telemedicine and let you know if you have coronavirus, if you should be worried, if you should be tested. Yeah.
Okay. You have a tool, you have a telemedicine tool that when you ask me a series of questions, I would be able to, you're able to tell whether if I should be tested. Is there a tool that you have?
Correct. So what was done again in first world was artificial intelligence. They used that to more or less combine a screening tool. So the CDC has one for first world. If you're from the Caribbean, they actually don't allow you to use it.
Oh, okay.
The IDB, the Inter-American Development Bank, they reached out to me at MD Link and they said, hey, let's try help out Jamaica. Let's try get a screening tool set up for them. And we worked together and we were able to launch MD Lex, which is a AI artificial intelligence COVID screening tool. It's on our MD Link platform, on the website, on the app, the mdlink.com. And it's free. That's the best part. So you register, you log in for free, and you use this for free. And it does assess the symptoms that you give to it. Add it together, multiply, subtract, and it can let you know what you should do next. Whether you should speak with a doctor, whether you should relax, stay home, whether you should get tested, whether you should head to the hospital right away.
Okay. And Dr. Bowen, we actually we've been conducting polls. One of our poll results, have you or anyone you know tested positive for COVID-19? 71% of our respondents said yes, and 29% said no. Then we have another poll here. How often do you clean and disinfect your workplace facility? 50% of our respondents said daily. 50% said multiple times per day. Nobody answered weekly, and nobody answered multiple times per week. Interesting. Yeah. So Nevada, you were talking about hospital visits. I think we should.
Yes. All right. Yeah. So you in a situation, or let's just start first from home. You've gotten COVID, but you're not sick enough to go to the hospital. So you're going to actually stay at home and try to self-treat. What should I be doing at home in terms of what meds or what vitamins or what should be in my house? And what should I just keep in my house just in case that I have it here already?
Great question. I would go ahead and say you want your vitamins. That's your vitamin C, your vitamin D3, and your zinc. Those
vitamin C, vitamin D3, and zinc. Okay. Yes.
Those are the 3 key vitamins.
Types of vitamin D is not just one vitamin D.
There are different types. It's specifically D3.
D3.
Vitamin C, vitamin D3, and zinc.
Okay.
And there are some vitamin companies out there that put these 3 together nicely for you, so you only have to take 1 tablet.
Okay.
Other
things? Other things that I need at home?
Hydration. Lots of fluids. People tend to take it lightly, drink water. How's that going to help? But it's just like having a drip up. You're flushing the virus out. The more you can urinate, the more you can get the virus out of your body. So you want to
I see a question here from Kia Minecraft, which I was just going to ask after I took a sip of water to flush out. Jamaican home remedies, the turmeric, the garlic, the ginger. I hear about, my mother is telling me about lemon skin that you boil, and turmeric, garlic, ginger. We can take that too?
I would not say no, but I would not say yes. I don't have the medical evidence to say yes, but I do believe in natural remedies. So if it's not causing harm, sure.
What about the breathing thing that many of us do with the either eucalyptus oil in the hot water or the Vicks in hot water, and you put the towel over your head to help you breathe. That help at all, or foolishness with when you're having COVID and breathing problems?
It would help with breathing problems, and it would help to open up your sinuses, and you know the heat and the warmth helps to open up your sinuses and helps you breathe better. But it doesn't help coronavirus. No, it doesn't treat coronavirus. I mean, it might ease the symptoms a little bit. If it does, that's beneficial, because we're trying to treat the symptoms as well.
Okay. All right. Now shifting gears. So I'm now very sick and I have to go to hospital. So the zinc and the vitamin C and D3 not helping me out. And what should I? What? Yeah, right. And the bed rest, of course. What should I expect in the hospital situation? What is the prognosis? What do we see? What meds am I going to take? Walk us through a treatment protocol inside the hospital.
Sure, no problem. So you come to the hospital, you know, if you have cough and fever, you have these COVID symptoms, you want to let them know right away at the front of the hospital. You let the security guard know. Where we are at a National Chest Hospital, you're directed to a COVID swabbing or COVID booth. We have a COVID section. You head there, you sit down, a doctor will come see you, assess you. If you're fine, they send you home to quarantine. If things look serious, we're looking at admission, you know, comorbidities, elderly, you know, their oxygen saturation is low. And that's, again, one of the key factors of COVID. When you compare it to any other virus, your oxygen saturation drops for no specific reason. Again, so if we deem you high risk and we say, yeah, this person needs to be admitted, they're more than likely COVID positive, we'll go ahead, we'll swab you, we'll take you up to the ward, of course, in PPE, full protective gear, and we do bloods. So we do a blood screening, look for any sign of infection, any other virus, diabetes, check for that as well. Do your vitals, check to make sure your vitals are fine and stable, because a big part of the treatment or the management is going to be around keeping your comorbidities under control, your diabetes, your hypertension, making sure you're not lapsing and are taking your pressure pills and you wake up with a stroke the next day. So you do your bloods, chest x-ray. We've put that in as protocol. So anyone that comes in, we're going to do a chest x-ray, and you can look on the chest x-ray. There are something we call COVID infiltrates that you see in the lung fields. And, you know, we can look at the chest x-ray, look at the patient and say, yes, this test is going to come back positive. We need to start treatment right away while we wait on that test. Because it will take 2 days for us to know whether or not this patient is COVID positive. So even in hospital, we're putting you on oral fluids. We're putting you back on the vitamin C, vitamin D3, and the zinc. We're adding antibiotics to make sure no infection comes on board and takes over. No additional bacterial infection, no lung infection comes on board. We add steroids as well. Steroids is to manage any sort of inflammation in the lungs, because what seems to be the most serious cause of death is when you go into respiratory failure. So we try to prevent that with.
And the steroids help to delay the respiratory. That's why Mr. Trump gets strong quick, just come out fast. What about the whole issue? Yeah, sorry, go ahead, Raj.
No, I just heard you mention people that you're not supposed to be mentioning. No, so I was just wondering what your next question is.
So, what are beyond the steroids and stuff? We hear about things like remdesivir and also, what are the other medicines that are part of the treatment? And then also the whole issue of the ventilator. When do you get to the point of ventilator, if it's needed?
All right, let's start with ventilator. The ventilator question first. And it actually goes back to the interesting fact that the coronavirus, the severity of the virus in Jamaica seems to be not as severe as it is in other countries. Again, could be the environment, could be the sun, could be the fact that we're not in cities, congested cities, could be the fact that we don't have an old population, an elderly population, we have a much younger population, could be the fact that we're American, more African genetics in the gene pool in the Caribbean. So a lot of other factors could be contributing to it. But yes, interesting that we aren't drawing for ventilators as much as as the other countries were.
Mm.
And the other interesting stats are that our cases are sort of plateauing. The rate of infection is plateauing. So that's good news. We're doing something right. We need to keep it up. So ventilators, again, it's to help you breathe. It's literally to breathe for you. You can't breathe. You can't move your lungs. You can't inhale or exhale because you've gone into respiratory failure.
Mm-hmm.
So, and we don't see that as much out here, but that's what it would be used for, to keep you alive.
So the difference between the ventilator and the oxygen mask, you are still breathing on your own, but the oxygen mask is just supporting you. With the ventilator, you're not breathing, and it is breathing for you, essentially.
100%, yes.
Okay. Now, the other medicines that we hear, remdesivir, other things that are part of the treatments and protocols, what else is part of the treatment?
Right. So we haven't incorporated any of those fancy drugs as yet.
Okay.
For because they were all developed a few months ago. I don't want remdesivir in my body. So it's interesting, you know, they were able to come up with these treatment medications because they had experience from previous viruses, you know, the SARS and the Middle East respiratory syndrome. And they were able to just use that, say boom, boom, and we have something to inject in these humans now. But you haven't tested it. And a few months down the line, you realize that remdesivir is not doing what you thought it was doing in the first place. So,
but that also leads us to the issue of the whole thing with the vaccine, right? Because obviously we're rushing to get it, Oxford, this, etc. Question: as an ordinary person, at what stage should I be comfortable taking the vaccine? What are the signs that I'm looking for? Because if we're obviously rushing it, and the world understands why we're rushing it, we need to get past this. But just say, what is the sign in order person say, yeah, I'm signing up for the vaccine now, or let me wait and make a year go by and watch other people? What's your view?
My view is, without the vaccine, coronavirus is here to stay. That's number one. Everyone is racing towards the vaccine. When they find the vaccine, when they develop the vaccine, that's just the beginning. Then they have to test it. So I would say maybe in 2023, 2024, that's when I would advise you to consider getting the vaccine. Usually,
hear that, people? Hold that thought. When I hear that, vaccine now coming on 6 months. Book, but all gone.
Usually, it's a 10-year period.
Yeah, but that's the ministry has actually been. I've been seeing a lot of advertisements about the flu vaccine.
Right.
Actually, be taking, because I don't think we were necessarily a nation that we took flu vaccine as a part of every year. Should we be taking the flu vaccine as one, not just staving off the flu, but as a potential way to stave off COVID-19?
Right, so the flu vaccine is at least 100 years old. It's been tested. So I support the flu vaccine. I do think that I got it myself at the hospital. I got it last week. And I personally am of the opinion that it would definitely help me if I were to get the virus and have that added support in my system. My body is ready to recognize other parts of the virus and help fight it off. On top of that, if I did get the flu, I'd be able to fight off the flu, so I wouldn't have the flu and coronavirus.
Yes,
which is a double whammy, and I'd be avoiding that. You know, I'm high risk. Every day I wake up and I run towards coronavirus. So, yeah.
So in terms of Nevada just pointed out to people to pay attention to that 2024, and this episode is about living with COVID. Do we also take that as a sign that we will be living with COVID for some time in the future?
Without a doubt, we'll be living with COVID for some time in the future. It's interesting. Everyone is like 2020, 2020, and then, you know, January 1st, 2021, coronavirus is gone. No people. That's not going to happen.
One of the things, Dr. Che, that we have seen and heard and stuff, so probably people who don't know this, that you're unable to visit your relatives in the hospital. And we have situations where people die without family around them and so on. Is this true? Is this how the thing work, and why is it like this? And why can't family members get full PPE and even go sit in and read two books to their family members? Why this draconian way of
approach to it? That is true. Yes, we don't allow relatives to come up on the COVID ward, and I think it's easy to recognize that it's a serious situation, and even to go into the ward, I have to get fully dressed, and it's a procedure. It's a procedure that I was educated and trained to do. My masks are fitted for me. I am health conscious, I'm health educated, much more than the average citizen. And therefore it's donning. Donning is the name of the process that you put on your gown and whatnot. So me being medically educated, I'm going to go in there and come back out, and I'm going to do it the right way.
Yes.
I can't at all. I can't trust anyone else.
Understood.
We
have a question here from Kia Minecraft that's asking the question: in America, there's a high rate of blacks dying. Why, if it doesn't impact blacks in the Caribbean, why do you think that we are differently affected than the blacks in the US?
That's an interesting question. I'm sure there's a lot of ways we could dive into it. I would go ahead and say that the large majority of blacks aren't the ones with access to expensive healthcare. The first top of the line healthcare in America, they aren't the ones with that access. They're the ones in the communities where spread might be faster even. So that's what I would say. They don't have the access that the rest of the population may have.
Mm-hmm.
The data doesn't show that Africans are affected more than
affected as much. Right.
I think the data currently shows the opposite.
Yeah. And we're seeing the questions coming in. Please continue sending in your questions and comments. Jana Pattison asked about the community spread phase nearing its end. Jana, we'll just hold that question for Dr. Webster-Kerr. But Owen Palmer asked a very interesting question. What happens to your organs after COVID-19 recovery? He says he's heard many horror stories.
Right. So, again, coronavirus, it goes to your cells. It goes to your cells, and that's where it keeps reproducing or increasing in intensity. And the cells that make up the organ, again, organ failure is what causes you to die from coronavirus. It's not actually coronavirus. It's the fact that your organs get so beat up by the virus, they just give up. So the question is, repeat the question for me again, please, Rochelle.
What happens to your organs after recovery?
Right. So after recovery, yes, your organs do have a high recovery rate. But I would say that depending on how bad or how severe it has damaged you, you may end up with a longer recovery period. But for some persons, but as far as I know, my patients, they have not had any sort of organ trouble, any sort of organ issues after being or recovering from the coronavirus.
Okay. And as you mentioned, recovery time, I see a question here from Joelle, and she asks, she's asking about recovery time, and she says, how come COVID quarantine was first 3 weeks to a month, now it is 2 weeks? So she wants to understand, what is this COVID recovery time? Is there a COVID recovery time, or is it as per patient and as per the effect of COVID?
Yeah, it's more a quarantine time. So 2 weeks is the time you should spend away from people. That's when you're highly infectious. After 2 weeks, the virus more or less starts to leave the body. Your body would have been able to fight it off. So after 2 weeks, you're either fighting off the virus or being hospitalized. That's how it goes. Yeah.
Wow.
So to answer that question, earlier we were just trying to learn about coronavirus and whatnot. So they would have said a month, but then they got the data and they reduced it to 2 weeks.
There was a question that was asked about if I've recognized that I probably have symptoms and I'm at home. Should I call an ambulance or take taxi to get to the hospital? If I know I've got hospital, is that an ambulance type? Am I better off trying to go with an ambulance?
It's a great question because, as you can imagine, you can see how that can affect people differently depending on what you can afford, basically. I would go ahead and say that the ideal way to do it, charter a taxi, make sure it's preferably you alone in the vehicle. Sure, ambulance, yes. But you definitely don't want to go and just be in a taxi full of people or on a bus full of people.
Okay.
Yeah.
One of the things. What about sex? Having sex.
So again, in an ideal COVID world, when you wake up and you get tested every single morning, once per day.
Yes.
In an ideal, if you really want to fight this virus, you split up the families. So you can't see your loved ones at all. Everyone on their own. No,
but then short of that, that we're not.
I think Dr. Bowen is trying to be as forensic as possible with that answer.
Yes.
Yes.
So I would go ahead and say yes. If you're having sex, if you're kissing, any sort of intimacy, you're at risk of spreading the virus.
Indeed.
So husband and wife should not be living together anymore. That sort of social distancing is the ideal world.
Yeah.
We can't reach there.
Sandra Palmer has an interesting question. How is it possible that there are 5 members of a household, 4 caught the virus and I did not? Yet that person has underlying conditions. We've heard situations like this, that intimate things and then somebody for some reason just not catching it. What is that?
That's an interesting question. I actually don't have the answer to that. I would say yes. I have seen a lot of situations just like that. Where, everyone is doing the same thing and only 2 persons catch it. So it leads you to believe that the coronavirus is picking and choosing. I know doctors that even when the first case landed, they didn't know. And they were interacting, no gloves, no mask, examining their eyes, listening, looking in their mouth. Negative when they tested for COVID. But the patient was positive. Yeah.
Dr. Che, as we begin to wrap up this segment, what else do you think that we have not covered that you think it would be good for the public to know as we live with this thing? What is maybe something that you think, boy, I want to make sure I leave with this message?
The most important thing I would want to leave with is that COVID's still there. Coronavirus is still here. People are still dying. It's still serious. I mean, it's ironic that now that the cases have increased, the fear has decreased, and that's not what you want. You need people to still be aware, educate your grandparents, educate the elderly, make sure they know for sure that it's not okay for them to go out and live their life as normal. They are high risk, and until we get things under control, obey the rules. Wash your hands, sanitize, social distance, and wear your mask. That's definitely what I'd want to leave and let everyone keep in their minds.
Yeah. Wear your mask. Thank you very much, Dr. Bowen. So we have had our first guest, who is Dr. Bowen, who is CEO of MD Link, on this very, very important episode of COVIDCastJA, Living with and Understanding COVID-19. If you're just joining us, this episode is available right here on our Facebook page, also available on our YouTube page and on smallbusinessportal.com. And thank you so much, Dr. Bowen, for breaking down these concepts to us. I think we really understand a lot better some of what some of the terms mean, how the tests work, what are the tests. But very importantly, I think you've debunked a lot of the myths around COVID-19 so that we can approach it with in a lot more educated manner. So just listen out for me, because I will be using these terms because I feel extremely bright now. And I do recognize for my own self that there are a lot of things I didn't understand about COVID. So thank you very much for taking the time to join us. Again, Dr. Bowen, where do we find, can you repeat the information about how we find MD Link? Because I know a lot of our viewers need to log on to MD Link. How do we find you?
Definitely. MD Link, that's the telemedicine platform. See a doctor online on your phone, on your computer. And you can Google it. You can Google MD Link Jamaica, it will pop up. Jamaica Telemedicine, it will pop up. Or you can go to the website, www.thetlemdlink.com. Or you can download it for free on the App Store, Google or Apple, MD Link.
Okay, so MD Link is an app. So thank you very much, Dr. Bowen. And we are going to be joined shortly by our second guest. So we're not done yet, because this is our full out broadcast. We're setting that baseline understanding. Our second guest is a principal medical officer she's a national epidemiologist in the Ministry of Health and Wellness. Her name is Dr. Karen Webster-Kerr. She's been in the public health practice for over 20 years and spent most of her time at the local health department in Kingston and St. Andrew. And while at that local health department, she led the response to the large urban outbreak of malaria 44 years after it was eradicated from Jamaica. The strategies employed, it resulted in the re-elimination of malaria. She's critically involved in Jamaica's response to the COVID-19 pandemic and leads the team in the characterization of the COVID-19 outbreak in Jamaica, the information for action. Dr. Webster-Kerr leads on national health programs and policies, especially as it relates to epidemiology and research. She is chair of the Health Thematic Working Group for Jamaica's National Development Plan, Vision 2030. She's also principal investigator for the Centers for Disease Control and Prevention grant, surveillance and response to avian and pandemic influenza in Jamaica, and is the co-principal investigator for the Jamaica Health and Lifestyle Survey. Now, we obviously can understand that Dr. Webster-Kerr is certainly eminent medical practitioner who is certainly in a position to take us on the next step of our journey with understanding COVID-19. Welcome, Dr. Webster-Kerr. Thank you so much for joining us.
I think you muted.
I'm muted.
Okay, no, you're fine now.
Very fine now.
A little better.
Excellent. Thank you so much for doing this. We know you had a long press conference before this, so particularly appreciative that you're coming on so late at night after that long conference. So thank you. Just to provide, again, some context for everybody who's just joining us, the goal of this program is to create a baseline understanding of how we're going to live with COVID. We began the show with Dr. Bowen talking about many of the ways in which we protect ourselves, what happens when what you need to have at home, what happens when you go to the hospital, and so on. And now we're joined by Dr. Karen Webster-Kerr to continue further the conversation from the community perspective. So thank you again, Dr. Webster-Kerr. So let's talk first about what is community spread. What that means?
Okay, it means that the infection has moved and we have a large number of cases. And these cases, we cannot really link them. And many communities may be involved in this phase of the outbreak or the epidemic.
So the whole idea of contact tracing now, we can't do as when you start to have community spread, you can't do the contact tracing, which is try to figure out how somebody got it as easily as you could before we had community spread. Is that correct?
Right. Well, in part. So we will still do the contact tracing for all the cases, but we cannot necessarily trace back where a particular person got the infection. So we continue to find out to ensure all the contacts of the person you got to ensure they are not infected, but we don't know where that particular person would have gotten it from.
Understood. Understood. So let's talk a little bit about quarantine versus isolation and what these various terms mean. When should I be quarantining or isolating, and how do I go about doing that? Are there resources available for people who need to quarantine or isolate?
Okay. So quarantine, let's start. Somebody can be exposed to an infection. COVID-19, an example. TB, other infectious diseases. You don't necessarily get infected, but if you are infected, it may take a while for that infection to show itself. And that is called the incubation period. The incubation period is different for different diseases. For example, COVID has a 14-day incubation period at its longest. And say TB may have an incubation period of months to years. Different.
And Dr. Carr, when you say TB, for those of us who don't know TB, that's tuberculosis.
Tuberculosis, correct. And so,
incubation period means that if I have it, it will show up in 2 weeks.
Right. But not everybody who is exposed end up with an infection.
Understood.
And so the quarantine period is for those persons who were exposed, but they don't know if they have it yet. So they are taken away from the general population just in case they have it and can spread it to others. Because COVID-19, you can start spreading it about 2 days before you actually have symptoms. Okay.
So if somebody has to quarantine, where do they go at this point? When you say you have to take them away, where would somebody be going?
So it can be at home. If you're home, you can be separated from your family for a period of 14 days. You have your own bathroom. Food can be provided for you without interaction with others. So it can be done at home. It can also be done in state facilities, which we have done for persons who the household cannot accommodate a person being separate. And so we have had a number of state facilities that have quarantined persons over the period.
Okay. And where would I call to if I know that I think I'm getting it, but my house is not big enough to have with a separated area? Which number do I call to try and get a facility for my relative or myself and so on?
Right. So every case of COVID-19 is a notifiable disease. So your local health department would be where you would call or would call you, because once we get a positive, the contact tracing starts. Right? So they are likely the ones who call you and will continue the investigation from there, including your close contacts. And then quarantine will then happen.
Understood. What is this contact tracing? What is the process of contact tracing? What happens? I've called in, I've identified that I have it. What sort of the mechanism that happens then?
So for the person who has COVID, we take a detailed history. who have you been in contact with? Where have you been over the period that you are likely to have been infectious? And we will go and find all those persons that you have been in contact, in particular, those who have been in close contact. And those persons, the protocol is that we will test those persons who have been in close contact with you to see if the virus.
What's the definition of close contact? If I was wearing my mask and 6 feet away from you, is that close contact or?
No,
okay.
Close contact.
So it's only if I wasn't wearing a mask and we were closer than 6 feet, you become a person of whom I was in close contact.
Right. And also we look at time. So if you are passing down the hallway, you don't have on your mask, I don't have on my mask, that is not considered close contact. We usually work around 15 minutes, close contact without mask or within 6 feet of the other persons.
Ah, okay. Okay. So just passing somebody does not constitute close contact in a hall and so on. Okay, that's very good to know and very clear. But if we're sitting in a room together, like a meeting at the office, and we're not masking or not distant, everybody in that room would be considered in close contact.
Okay.
I don't think I completed the definition for isolation. So isolation is the separation of the person who has an infection. So the person with COVID-19 will be isolated.
Ah.
The person who is exposed, not sure if they have it yet, is quarantined.
Okay.
And isolation means you are in the hospital, no? Or not necessarily?
Not necessarily.
Okay.
Because you can have COVID-19 and you're asymptomatic. For example, your close contact, we tested you, we found out you're asymptomatic. So you may not need hospitalization. It is a similar principle to the quarantine, that you separate yourself. You have your own room, own bathroom, etc. And you stay away from others if you are isolated at home. If you're isolation of the hospital is obvious, you're separate. And as the doctor who was on before explained that there are barriers to that they would put on, or we would put on, to ensure there's no transmission between the patient and ourselves. So they maintain the isolation in that situation in the hospital by wearing protective equipment.
Okay. Dr. Webster-Kerr, where can people go to just have the most up-to-date information about how to protect themselves and so on? Which website is it that, or websites would you recommend that are like, these are the ones you should, this is, because we realize that the situation is evolving. Where would we go to kind of say, okay, this is where the CDC, is it our ministry? Where would we go?
To get the Jamaican context, you would go to Ministry of Health and Wellness. The World Health Organization, the Pan American Health Organization are very good sites to give you the information and to stay away from some of the misinformation that's out there, So those are what I would recommend. And there are a number of links to other credible sites if you go on these websites.
Dr. Webster-Kerr, so as COVID-19 develops and we get more information, you just talked, and we're very grateful for that differentiation between quarantine and isolation, because I think we use these words interchangeably. But in addition, there are other phrases such as infection control protocols, as opposed to infection spread measures. Can you talk to us a little bit about those terms and what's involved in infection control protocols as opposed to infection spread measures?
Okay, so infection prevention and control measures, we call IPC for short, are those measures to decrease the risk of transmission.
Okay.
So COVID is a respiratory disease, so many of the measures are related to that. So the wearing of masks being one, the separation of distance, because most of this spread is through droplets and should drop before it reaches 6 feet. So most. Then the hand washing and hand sanitizing, because we know persons with respiratory illness are likely to cough, touch their nose, touch their face, and so hand washing is important. If unable to wash your hands frequently, then hand sanitization is important as well. So those are in general infection prevention and control measures. The biggest or the most effective measure for infection prevention and control is the infrastructure that we have for prevention. So if you're in an office situation, it's best that you have the distance, separation can be done, some barriers to prevent persons from interacting with each other. Then those are the most effective ways. Because even within hospitals, we don't go in to see a patient who is infectious unless we are well gowned and so on. And we don't spend unnecessary time there.
Yeah.
But separating them in a room allows for us to prevent transmission. And similarly is what we would do to prevent infection in workplace, at places of worship and so on. So the distance, keeping the distance, and as best as possible, barriers to transmission.
Sorry, Dr. Carr, quick question, because I know some people, if I am infected but asymptomatic, so I don't know, and I disinfect my hands, if I touch somebody afterwards, can I spread it? Or does the fact that I've disinfected my hands at least makes me a barrier? It won't spread for some period of time.
Right. So if you're disinfect or wash your hands, then you're unlikely to spread it if you do it properly.
If you do it properly, yeah.
Properly. So hand washing and washing for to ensure that you take off all the particles is important. The use of hand sanitizer on dirty hands is not very effective. So if your hands are soiled, the alcohol doesn't work as well. So if your hands are soiled or visible or feel sticky, you really should try and wash your hands, or at least remove some of the dirt, and then use the hand sanitizer.
Yeah. And proper hand washing, because I know there was hand washing, like you sing happy birthday, and that would take you through proper hand washing. Is there like a proper way to what? Because you know sometimes we just pinky with hand washing, we just underneath the water quick and out. What is the correct way that we should be washing our hands, and what should we be using to wash our hands? Is there special antibacterial soap that we should in fact be using to wash our hands? Should we be continuing this?
Well, basic soap and water is the thing. Having antibacterial is fine, but plain soap and water, because it's the action of cleaning that you want. So you're washing off the germs. So if you wash your hands properly with soap and you rinse it off properly, you would get rid of the dirt and the germs.
Yes.
So that is important, the act of hand washing.
Okay. And Dr. Webster-Kerr, you spoke about the workplace environment, and you know we use words interchangeably like cleaning and disinfecting. Now, from where you sit, is there a difference that you consider in the workplace protocols with how is cleaning and disinfecting one and the same thing, or are they considered different things?
Well, they are different. Usually, you're removing the dirt and the grime, which you have to do before you disinfect. So that cleans the the surfaces, and then you can go afterwards with a chemical disinfectant to kill the germs. So part of the cleaning will remove most of the germs, if not all. Then you go on top of that with a disinfectant to kill the germ in it.
So what about at our house? Because some of us are very finicky. Everywhere we go, we wonder, I wonder if them disinfect this place. But at our house, we don't really disinfect nothing much. What kind of cleaning and disinfecting protocol should we be putting in place in our homes if we haven't done it already?
If it is that you suspect that somebody may be exposed or infected, then the high touch areas should be cleaned more frequently. But I find most Jamaicans are very clean and routinely clean. So routine cleaning is pretty good, you know. So
bleach.
Actually, Doctor,
too, you know, and I hesitate sometimes in speaking about bleach because we have known of persons who have bathed in bleach and caused serious issues because they heard that bleach kills of these germs. This was, I recall, chikungunya and Zika, persons were bathing in bleach. You know, so I'm very cautious how I speak about bleach, but yet bleach will kill this virus.
Dr. Webster-Kerr, there's something that I do, and I don't know if it's madness. And anytime I bring stuff back from the supermarket, Appleton rum, everything before I put it away. Foolishness, or actually, I'm doing good.
It doesn't hurt. It doesn't hurt. And I laugh because I have members of my family who does the same thing.
Over here too. They spray out everything.
Yes, I think can't spray with alcohol and wipe with some wipes, and it doesn't hurt.
Okay.
In regard to how we are treating our exposure at work, at home, at school, on public transportation, are there any guidelines that you would want to share with us with how we should be protecting ourselves when we go in public? We're in a public space.
Right. So we should really be following the protocol. Wearing a mask is critical. If we're transporting, say for instance, personal experience, if I'm going with my father somewhere, we don't live in the same household. We're driving in the same vehicle. I have on my mask, he has on his mask, and the windows are broken, so to allow some air to flow in and out. So the protocol is for if you're taking public transportation, everybody should have on their mask. The windows should be down. And there's a reason for that, to prevent transmission. What we have discovered early up in our outbreak, that it's about 3.5 times more likely if you are traveling in the same vehicle with an infected person for you to get it than somebody living in the same household as you.
Wow.
So just the fact of driving in the same vehicle increases your risk. And so whatever we do or recommend must be sufficient to prevent that spread.
Actually, Dr. Carter, I have a question now on that with the car situation. Now, obviously, if the car full, it's not great. But if it's only 2 of you in the car, like you and your father now, so you're driving, what is the best seat for him to be in to minimize cross-contamination? Where would you put him? Is it better in the back, on the other side?
It depends on the airflow in the vehicle. So I would say it actually should be in the seat beside you. Because the air flows to the back. So it's like a better for him to be sitting. This is just working it out as we speak.
Yes.
Because, and even on an aircraft, it's better to sit at the front first class than
in the back.
Hey, I get everybody germs. Run at the back.
So yeah.
No, understand. Yes.
So, Dr. Webster-Kerr, are there situations that we should seek to be avoiding completely?
Situations to avoid?
Or places that we should avoid?
Parties, large gathering, that's where the problem is right now. Because, for example, Westmoreland, the communities that having the parties are having the highest cases. So we have to, those parties that are going on, even at homes and, well, we're hearing about bars and so on, it's where to avoid right now.
And Dr. Kerr, with parties, I know that sometimes, people will be having just a little gathering at the house.
And the outside.
Outside, and say about 15 of us, and we gather and we're outside. And we say, but are just 15 of us. In those situations, should we be having those 15 of us gathered together? And if we do, what should we be putting in place to protect ourselves?
I hesitate because we really shouldn't, because we're mixing different households when we do that, and it increases the risk of transmission. So we have seen a few of that where these smaller parties have caused spread. So we're a different household. If we must, I would say we have it outdoors, everybody sanitized, and we keep our distance, which I don't see how we're going to do it, but that is what we should do, because we're going to want to eat and have a drink and we need to face, so the risk is there, because the positivity right now is about 10%, little about 10%. So if you're having a party of 15, 1 or 2 persons there possibly have COVID. So that is the
Dr. Kerr, just so that we understand, positivity means that if you test 10 random people, 10% of them are likely to have it. Okay.
It's mostly contacts and persons who are ill. So it is in a special population. How much is it in the community? Because we have done some community testing, which that sort of randomness is in it, where we have found over, say for instance, Cornwall Court. Well, we know that's a special community right now. When we went in, it was about 14%. So if you're in that community, what is that? About 1 out of 8 persons would have COVID-19.
Wow.
So it is that's a risk you take when you have multiple families coming or multiple households coming together. The other thing is to protect your own household, because when I go out, I'm fully masked and ensuring I follow hand sanitization and keeping my distance. Because you're protected. Because when I come home, I don't want to remove my mask and be free. So we need to follow the protocol at home as well as outside.
So you keep your mask on even when you're at home?
No.
Oh, okay.
So you try to ensure you follow the protocols in such a way that you're home, you feel free.
I'm free of my mask. And if I go into a situation, if I go into a store and persons are not wearing masks properly, I will come out. I do say to persons, you need to put on your mask, but I don't expose myself. Persons don't come into my office without a mask. Or in the Ministry of Health and Wellness, everybody have on a mask and they wear it
Dr. Kerr, I think you raise a crucial point here, and the responsibility we have, not only for what we do for ourselves, but to not allow ourselves to get into situations where people aren't following the protocol. And we must call each other out and say, look, I'm not coming in this store. You've allowed all these people in the store without masks. Me not come shop here. You know, we also have to reinforce the behaviors by also articulating, you know, what we find acceptable and what we don't find acceptable. So if you're getting into the bus, for the bus people not wearing masks, say, no, I'm not taking this transportation. I'm going to wait for the next one until everybody masks up.
Right.
Yeah. Dr. Carr, we've actually been conducting some polls, and our last poll that we've had is, does your workplace have posters, videos, or message boards in place to raise awareness about COVID-19? And 100% of our respondents said yes. So in the workplace is information available. So Dr. Carr, we actually want to go through a few scenarios with you. But before we go through the scenarios, do you find that as we are living with COVID, that we are getting sometimes a little relaxed living with COVID? So we sit me and call live with me, and we say, but we go through 8 months with the COVID, we not catch it. So we start wearing the mask on the ears, or we don't wash our hands as regular, we forget the sanitizer at home. Do you find that sometimes as we are going through living with COVID, we're getting a little relaxed with our measures?
Yes. And I think most people don't feel they're at risk for COVID. The little one-on-one we have had with persons on the ground, they're not at risk. They don't feel they're at risk for COVID. Or their community, not one of the communities with COVID. And we see the difference. For example, Church Corner, initially when we went in, they felt, you know, they were not at risk for COVID. But afterwards, everybody was wearing their mask and ensuring they're keeping their distance and so on. And it has proved good for that area. And for St. Thomas as a whole, today's conference, we discussed about St. Thomas and about they have 4 active cases now in St. Thomas. Hopefully that continues, but this is that situation if we slip a slide, in a sense. If we stop doing what we need to do, we are in trouble. Because we talk about the positivity rate, we're still in community transmission. A positivity rate of about 10 or a little over 10 is too high. What we want to do is to get it below 5%, and better yet, below 3%. And for 4 weeks to say we're out of community transmission. So we're not nowhere near out of transmission yet.
Wow.
Although the numbers are going down very nicely. You know, feeling good that there is some positive, but we're not out yet. And if we increase from where we are starting at a higher level. And so the exponential rise that can occur again would take us much, much higher than where we were.
Okay.
As we wrap, Dr. Kerr, any last words, final words to kind of leave with the public? You've covered a lot of area for us and a lot to think about and to be serious about. But I wonder if there's other things that you may say, boy, make sure beyond the mask and the social distancing, the disinfecting, what are other things that we should be aware of?
Somebody in my household should contract COVID. What do I need to be aware of now? What should I be doing in such a situation?
Somebody has COVID, we have to see how we can separate them from us and to ensure that we, at all times, both the person who is sick and the person who is not ill and may have been exposed, they have to wear their mask, but they still keep their distance. Hand washing is important. And probably call each other on the phone in the next room. Keep the lines of communication open, because the distance should be physical but not social, because there are a lot of mental
oh yes,
from not having that socialization and talking to persons. So we have to keep the communication going, even if it's in the next room. They're locked away, but not forgotten.
Yeah.
So in fact, it's really physical distancing, not social distancing.
Social distancing.
Yes.
And that's such an important point, Dr. Kerr, because you are seeing there's a lot more discussion now about mental health issues that may arise from COVID and from us not socializing. But sometimes the socializing really need to be a video call or a telephone call to keep those communication, to keep the communication going. Yeah.
We had, it's a personal experience. We had a family reunion, a Zoom family reunion, and it was great. Person in England, person in US, we talking. We had breakout session and we had rap. It was fun. There was a DJ hired.
I love it.
You know, so we can find creative ways, and we know we have creative persons in Jamaica. We can find a creative way to stay connected.
Yes. So is physical distancing, maintain the social part of our lives through creative ways, keep those hands washed and don't sanitize dirty hands. Hands need to constantly be kept clean, and we continue being good Jamaicans where we clean out the place, we disinfect down the place. We were always good at that. We just need to continue, and let's not relax at all with our COVID measures. Let's keep them up. In fact, amp them up so that we can reduce this community spread.
Yes.
Yes.
Excellent. Thank you so much.
Thank you so much. Thank you so much.
Okay.
So our viewers, we were just joined by Dr. Karen Webster-Kerr from the ministry. She's the principal medical officer of the Ministry of Health and Wellness. And Dr. Kerr actually just joined us from the ministry's press conference. So we're very pleased that she could be here with us this evening, and an evening full of information, Nevada. We had Dr. Bowen, founder and CEO of MD Link. What are some of the key things you learned from Dr. Bowen today?
Boy, I have to say, first of all, I finally understand the whole PCR antigen antibody thing, because that was also confusing me, and also about when to kind of get tested. So for me, that was a critical thing. I think the whole idea of the 2 masks on the bus in a situation we can't easily do physical distancing, that's something we should be aware of.
Or when you're going on a plane, yes.
Or exactly, absolutely. When you're going on a plane, he talked about what you need to keep at home, and maybe you should just have it at home just in case. Remember, vitamin C, vitamin D3. Rachel never knows there was another thing, but it was vitamin D3 and zinc. So make sure that is at home, that you just have it just in case anybody get it and you're ready. I got the explanation difference between the ventilator and the oxygen mask. That was good, and why relatives can't visit you as depressing as it is in the hospital. So for me, this idea of creating the baseline was what is really crucial, because you hear a lot of information. Remember, both foreign stuff coming to us and local stuff coming to us. So for me, that was very good. What about you? What were some of the key takeaways, even from Dr. Webster-Kerr?
So, from Dr. Webster-Kerr, certainly just the understanding of where we are with community spread. And you know, there's some simple things that you think you know. And I really never thought about the distinction between quarantine, which is when you've been exposed, and isolation when you actually have contracted COVID-19. The reminder too that it is physical distancing, and you know what we mentioned as social distancing, we still have to maintain social lives, because it will lead to mental health issues. I see Chris Record here mentioning twice daily meditation to reduce anxiety. Download the Calm app. So it was very important, some of those key distinctions. And just the simplicity of the measures that we have to take. Washing our hands, a reminder about washing our hands, and that, you know, you put sanitizer upon dirty hand, because, you know, sometimes we sanitize down the place, we are sanitizing, but we have them dirty because we never wash, we haven't washed our hands for quite some time. So as Dr. Carr also went through some of the community spread examples, which are very real examples, and putting the measures in place and the reduction, but just to reinforce to us that COVID is still real. 1 to 10, probably 1 in 8, and even with our small gatherings. So, you know, when you mentioned the car, I just like, I never thought about that car thing. Like, you know, when
Rochelle, there's a question here that I think I just want to address because it come up in one way or another from Sound Positive, right? And this is what we call the skeptic. We now social distance. There is no COVID. It has made a conspiracy to dominate the global public. I mean, now be fooled by them government who want me for a slave. All right, here's the thing. And by the way, your position is out there, quite common and stuff, and we've all heard it. But you have to think for yourself. France, Germany, America, Australia, New Zealand, all of these countries, right? Africa, everybody is dealing with this thing in one way or another. And the chances that all of these people got together to try and fool up the whole of us, to destroy destroy our economies, to destroy global economy, to destroy travel. Just think for a second if that really, really makes sense. Rich people who want to have this businesses to continue, small business, want business to continue. What are the chances that all of those people could get together and create this chaos in order to just make sure you are a slave and me's a slave? Sometimes we must think. We must think that it just don't make sense. If it was like a one government doing something, you can say, boy, I may be suspicious. But this is every government in the world, every economy in the world is cratering. So we have to be sensible. I mean, I think all these people cannot be lying to us. And even some of them are lying, there are those experts who would have said, look, people are lying. That's not what's going on. Especially someone who has been personally affected by COVID, because my relatives have died and I went through the whole process. So this whole thing about it is not foolishness. It is real. Real people are being affected. Real people are getting sick. Real people are dying. And we must use our brain, right, to be able to say how we're going to manage this. Because the more skeptics we have, you're putting all of us at risk. I just want to point out, because thank you for your comment. We need to hear it, but we have to also address it.
No, I think that's very, very important comment, because, you know, sometimes we say too that we now be fooled by government. We now be fooled by anybody. We don't have to be fooled. That's what this episode is about, living with and understanding COVID-19 for ourselves. We don't have to be fooled. The information is available. And for those persons who have actually lost loved ones, who have gone through the pain of death of loved ones or critical illness, and they're still going through it, it is very, very real. And for our island, when you think about for a country like Jamaica, where students are at home trying to be educated, where we have to be working from home, we have had to have lockdowns, we have had to close our borders. If nothing else, we have to say to ourselves, I wonder, make we err upon the side of caution, because that thing look like it could have real. So we needed tonight to set a baseline understanding. So we don't have to be fooled. We have the information. We can dig deeper because now we have Wi-Fi, we have the internet, so nobody now have to fool we again. So thank you for that comment, Sound Positive. And this is what the show is about, because we want the questions to be asked. We want the comments. We want to have the information out there. So I see Max Nord saying it's mind-boggling to think that people would think that. So the world has conspired to destroy their own country. I guess the deaths are also fake. It ain't fake. COVID ain't fake. So thank you. Roger Simon says, I've just come to the realization that COVID-19 will be here for another 2 years at least. And he goes, sigh. So Nevada, earlier and if you look back at several of our episodes, because we have in fact been talking about this, we're at episode episode 31, and you can go back and view the episodes. Nevada, I will give you the last word, because one of the things you have said from the get-go is COVID is going to be here with us for a while. So in terms of the living with COVID, based on just the information we've had tonight, information we've gathered from businesses, what are probably the three key things you would want to leave people with tonight with living with COVID?
First of all, I want people to realize, because everybody had asked, how come COVIDcast covering this topic? Remember now, this is a critical part of doing business and living in the community, right? So although we are a business program, all business now is going to take place in the backdrop of COVID occurring. Mm-hmm. So from our perspective, addressing the COVID issues and trying to clear up all the kind of confusion that's out there is a crucial part of us getting smarter about how we're going to live with COVID. It was unbelievably helpful for me in terms of the learning. I certainly hope it was helpful for those of us who are listening outside. Remember, the episode will be on Facebook, be on YouTube, and also be on smallbusinessportal.com. So if you need to go back, please share this. Make sure all your relatives know. Make sure your students know, your teacher know. Make sure we want as many Jamaicans as possible to be fully informed. That for me is the most crucial thing. As broad as we can spread this video, we should do it to ensure that we are protecting ourselves and protecting each other, protecting our workplaces, protecting our schools, protecting our homes. Very, very crucial. So, Rochelle, for me, it was a fantastic program. I learned a lot, and I hope others did too. Thank you.
Yes. And as Nevada mentioned, all our episodes are available on Facebook, on YouTube at PSOJ, Financial Access, and as well as on smallbusinessportal.com. Next week, we are continuing our discussions, but what we're going to be looking at the best in class in industries in the response to COVID. So what has actually been working well? Because Jamaicans, when we do something good, we do it well good. So we're going to be talking about best-in-class industries in the COVID response. That will be our episode next week, Thursday. And please, as Nevada said, share, comment, tell not just a friend, tell all of your friends them, all of your family them, not just in Jamaica, but everywhere, to watch this episode of COVIDCastJA. But we also encourage you to watch all of our episodes because they're full of critical information as we survive and thrive during COVID. So we're going to see you again next week, Thursday, at what time? 7:30 p.m. for another episode of COVIDcastJA. And remember, right now, subscribe to our page on YouTube, like, comment, and share, and go and visit smallbusinessportal.com. See you next week. So you have a great idea to start a business, but you don't know where to start. We completely understand. You have a lot of questions and almost no answers. Smallbusinessportal.com is here to help. At smallbusinessportal.com, you gain access to information on loans, grants, and investment opportunities from verified financial institutions. Guess what you also get? Useful business tips, access to training. All these services combine to make your business idea into a reality. Start your journey today at smallbusinessportal.com.